Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about drug abuse and illicit trafficking prevention. Joining me on the program today is Dr. Travis Freeman, the project lead of the Drug Demand Reduction Department. Welcome to the program, Dr. Freeman.
Thank you for having me.
So, with this year's observance, could you explain the importance and the aims of the International Day of Drug Abuse and Illicit Trafficking?
So, the World Drug Day is marked the 26th of June on every year, and this is marked to strengthen the action and cooperation to end drug use in our society. This year's World Drug Day theme, or the International Day Against Drug Use and Illicit Trafficking, is People First, Stop Stigma and Discrimination, and Strengthen Prevention.
Why this theme? What is the importance of this theme?
All right, so for the aim and the reason for the theme is for us to treat persons who use drugs with respect and empathy.
Definitely. What strategies has the Ministry of Health adopted to combat drug abuse and trafficking over the years?
So the Ministry of Health has adopted a few strategies, particularly in the area of prevention and treatment. In prevention, we have targeted our what we refer to as our target population, which would include in and out of school youths, persons from communities where there is some sort of marginalization, also institutional use and other target groups. So those are the areas or the populations that we focus on, and the intention is for us to delay the onset or the initial use of drugs. Hence, why we're focusing on those in and out of school youths.
Thank you, Dr. Freeman. What can the general public do to join the Ministry of Health in the fight against drug abuse and illicit trafficking?
So thank you. That's a great question, Alicia. So that you know that in the response to the drug situation, there are many stakeholders, and the general public is actually a stakeholder. So when we see persons or we suspect persons are misusing a substance, rather than discriminate or stigmatize against them, we can get them help. We can get them treatment at one of our drug treatment and care sites. The Ministry of Health currently has more than 10 treatment sites, and they're all accessible at our local community health facility.
Wonderful. What would be your encouragement to the general public, even as we observe this day? What would be your encouragement to them and even those persons who may have had or may have family members who are struggling with drug abuse and these kind of things? What word of encouragement do you have for them?
So I would just like persons to know that there's help out there, that the Ministry of Health is providing and has accessibility and availability of health services to treat substance use. Substance use is a big issue, and it does not have to be taken on by you only. We're here to help you and to work along with you to getting the right help that individual who might be misusing a substance needs. I want to encourage our youth, our in and out of school youths, not to use drugs because of the dire health and social impacts that substance use have or drug use has.
Hookah is not a safe alternative to cigarettes. Hookah products contain at least 82 toxic chemicals, including tar, carbon monoxide, heavy metals, and carcinogens. People who smoke hookah may be at risk for some of the same diseases as cigarette smoke. These include oral cancer, lung cancer, stomach cancer, and decreased fertility. One head of hookah is equivalent to 70 cigarettes of nicotine. 1 hour of smoking hookah is equivalent to 100 to 200 times greater volume of smoke inhaled than with a single cigarette. For further information, consult the Chronic Disease Unit at the Ministry of Health at 223-7355.
Drug trafficking also fuels additional criminal activities, which include human trafficking, firearms trafficking, money laundering, and financing terrorism. These crimes are responsible for the loss of life, the breakdown of family relationships, poverty, the destruction of communities and citizen security, even instability within a country. New psychotropic substances, which are being introduced through the multiple channels along which drugs travels, including the sale on the internet, the dark web. In addition, there are other products which are available to the youths, especially such as gummies with ITHC, which the Customs Anti-Narcotics have been having a lot of seizures of, marijuana cookies and cakes for sale right here in Guyana. These also pose a serious health risk since the preparation is done by those who are not certified chefs or chemists. Now, more than ever, collaborations between entities is required to address the expanding phenomenon. The Customs Anti-Narcotics Unit, functioning as the National Drug Authority, has endorsed the need for cooperation among entities and seeks to bridge gaps between agencies whose functions relate to either stemming the flow of narcotics, providing treatment, or working to implement preventative measures to prevent forced use or to deter use completely. The unit has emphasized the strengthening of agencies working in supply reduction, demand reduction, developing control, placing major emphasis on institutional strengthening and international cooperation. Well, as Dr. Freeman would have mentioned, that's where the Guyana Drug Information Network comes in. We function as the hub. We're all representatives from the various entities who are dealing with the reduction of drug use or deterring drug use, whether it's supply demand or demand reduction. We meet, discuss, come up with initiatives, and sometimes even policies. We have created the National Drug Strategy Master Plan, which is presently operational. The unit continues to be involved in awareness sessions aimed at youths in schools through community outreach, the majority of which involves the collaboration with ministries of home affairs, health, and education, among other ministries and governmental and non-governmental organizations. In parting, I will reiterate that the fight against illicit drug trade and drug abuse will rely heavily on a multi-sectoral approach, which will examine every aspect of the situation in order to develop strategies that will yield successful results. Let us work together to create a safer Guyana. Thank you.
What do you call it? Cold one, hard stuff, booze, liquid courage? The list is long, as is the list of its effects on the brain and body. We know the behavioral changes, we've seen it before. Slurred speech, changes in mood, unsteady walk, or even total loss of consciousness. It can cause other bodily damage too, like damage to your heart muscle, high blood pressure, stroke, liver damage, immune system suppression. It's also a known risk factor for cancer. Those are just to name a few. What about the people around you? Alcohol can influence domestic violence and cause road fatalities. Don't cause or become a statistic. Stop, think, don't drink. A message from the Ministry of Health Chronic Disease Unit.
Sometimes we don't know what to do with these persons. We don't know how to manage them. We don't know which agency to call. And for those persons, they end up in a very vicious cycle. You heard Mr. Richards describing some of what would happen with those persons, because maybe they start out experimenting with drugs, and then from experimenting it becomes a habit, and when it becomes a habit, they have what is called a psychological dependence on the drug, because they believe if they don't use it, then somehow the day would not go well. And so they develop that psychological dependence, and then they move to physical dependence because the body starts changing with the use of drug. There are lots of medical complications that would arise from that. We know for those who do intravenous drug that they can get a lot of other infections. And in fact, we have seen with HIV that you have persons who are intravenous drug users who would contract not just HIV because of sharing of syringes, but they also end up with things like hepatitis and a whole host of other infections. So it's a big problem. We also know that those who have been using drugs, some of the physical problems that they can encounter is damage to their heart, their lung, their liver, and other parts of the body. It's a huge problem. So one of the things, as you heard, that we are trying to do on the medical side is to work on how do we get people to prevent these habits from forming. And I think the logical place for us to go is to go into schools, to talk to school children. Probably with that type of education, we're hoping that they will change behavior. But for a lot of people in public health, you would know that raising awareness alone does not change behavior. Behavior modification comes in a different way, apart from raising, uh, the value of education. You also have to practice. And that is more important because a lot of time we raise awareness and these programs fail because we have not gone through the cycle of inculcating what they learn into that change that we want to see in them. And that's how we have to modify some of the programs that we're offering. And so in terms of prevention, while we'll be collaborating with the Ministry of Education and going into schools, if we do it in pockets, it's not going to work. We have to do it on scale. And so when we're talking about these things, we really need to do it at scale. The Ministry of Education, they have a program, I think it's called Healthy Family Life Program. And in that program, the teachers need to be involved. It's not just the Ministry of Education going in to talk to people about this. This must be part of the curriculum that a child would receive during their stay in school. So that's one way that we have to work. But the other thing is that we have a population of young people who have dropped out of school. And we have to find a way of working with them because in many ways they're more vulnerable. So those who drop out of school, we have to figure out a way of how to reach them and how to work with them. I don't think we have all the answers. I know we have been working with some of them, trying to bring them back, giving them a second chance at education by giving them some practical skills and so forth. But we also need to figure out how can we work with them to give them this type of education and guide them away from substance abuse. And this is very important. So you have this category that we're working to do prevention, and we need to figure out how to do that and do it very well. So this whole question about stigma and discrimination, I think we can borrow some of the lessons that we have learned from HIV and apply it to what we're doing here now in terms of substance use. And I think it can make a big difference. So I don't think we have accurate information on how many persons are affected by this, but certainly this is one area that we have to work on. Now, while we talk about illicit substance, meaning things that are illegal, as Dr. Codina pointed out in his talk, we have things that are legal that are problematic. And those substances that are legal that are problematic includes tobacco and it includes alcohol. But because they're legal, people go and abuse them. And when you think about alcohol, in some of the bars that we have, they have happy hours, so you double up the enjoyment and you double up the amount that you consume. But what happens when you double up is that you are affecting your body. I remember many years ago when I used to work as a physician at the Georgetown Hospital, I saw a guy came in, and he came into the emergency department with a broken leg. And the reason why he came in for his broken leg is that he had a cutlass and he was chopping the ear, and then he started chopping this banister that the step, and he chopped the thing off, and then he fell over. And when you took the history, the reason why he was there is that for the last week he was drinking alcohol. And there's a state that you can get when you get delirium because of this alcohol, not just because of the intoxication, but it really affects you mentally. And he fell off, broke his leg. We start treating him for the broken leg, but then we quickly realized there was a bigger problem behind that. We had to call in the psychiatrist. They had to start looking at him from that angle. But these are the kinds of problems that we have, and we need to fix it. So today is just one of those days where we use it for awareness, but we have to keep at this, working at this, throughout the year so that we can actually make a dent on the problems that we have with drug use. And alcohol is a big one. We need to really focus on that. We need to focus on tobacco because we're seeing the damage that it's doing to a lot of people. A lot of the patients that come in with chronic diseases in the hospitals, we can actually identify that many of them in their history, their patient's history, that you will have alcohol use and cigarette smoking. And this is something that we can change. It calls for behavior modification, and we can change that. Plus, we are having these challenges with persons who are using drugs, and we have to work on that very seriously. So today is just one of those days when we want to raise awareness, but more importantly, it's not just about awareness. It's about how we have a continuous program and collaborating with the different agencies so that we can change patterns of behavior that exist among some of our citizens and those who are most vulnerable, that we can provide them with the guidance, provide them with the community support to keep them away from drugs. And if we're able to achieve that, then as a country, we want to see that we become drug-free. And that should be our ultimate aim.
Thank you for joining me on the program today. I'm your host, Alicia Martin, saying goodbye for now.